The call will be recorded. If you have any questions or any comments, again, please use either the Q&A or the feedback. You can also just ask the question, and I'll be kind of forwarding the slides as Christina does her presentation. So, Christina.
Good morning, everyone. I'm Christina Shaklee. I'm the Workforce Coordinator here in the Office of Primary Care Access in the Health Systems and Infrastructure Administration. And I wanted to have this coffee talk to give you more information about the State Loan Repayment Program. We have an application cycle opening up in the next couple weeks, so I was hoping that this would be a good resource for everyone. So I'm going to go over the objectives. Dwayne, if you could go to the next slide.
Gotcha.
So in this call, I plan on just giving you an overview of the Office of Workforce Development, giving you an overview of the State Loan Repayment Program, and then discussing the program requirements and eligibility requirements for providers and sites for the Loan Repayment Program. I'm going to briefly touch on the application process and the pieces of the application so everyone has a better understanding of those. And then I'm also going to talk about some other potential loan repayment options. Next. So the Office of Workforce Development was actually created last July when the Health Systems and Infrastructure Administration was created. I've been in this position since January of this year, and we're primarily responsible for ensuring adequate health workforce, especially in the most high-need areas of the state, such as the HEZs. I market and administer all of the workforce programs, the J-1 Visa Waiver Program, the State Loan Repayment Program, and the National Health Service Corps to expand access in these underserved communities. And, you know, moving forward, we plan on utilizing more data and local community engagement to really better understand the workforce needs within the community. And as the SIM model develops, we hope to integrate the workforce programs and workforce development into that as you know, more information comes out around SIM in Maryland. Next slide. So as I mentioned, I oversee the 3 workforce programs, the State Loan Repayment Program and the J-1 Visa Waiver Program, which we administer here in our office. And then the National Service Corps is the federal program that we provide technical assistance to sites and loan repayment applicants. You can find us on Facebook at facebook.com/Maryland OPCA Workforce, and I try to give weekly updates about what's going on with all 3 of those programs and other workforce programs within the state. So the State Loan Repayment Program, it offers educational loan repayment to primary care providers who agree to work in a health professional shortage area. At this time, practitioners must be working for a nonprofit organization. Currently, the program is only open for primary care physicians, but our office is really looking to expand provider tapes to include physician's assistants, nurse practitioners, and social workers. So that's something that we're working on internally. Right now I don't have any updates on that, but hopefully in the future we'll have a more expansive program. Priority is now given to applicants that are working in a health enterprise zone, since those areas of the state are really deemed, you know, the most needy areas of the state at this time. The applicants would still need to be working in a shortage area, and they would still need to be meeting all the eligibility requirements. Providers are given a 2-year obligation period with a $50,000 loan repayment award. So they get $25,000 at the beginning of the first year and then $25,000 at the beginning of their second year. Next slide, please. Currently, we have 32 participants participating in the program. The State Loan Repayment Program works with the Maryland Higher Education Commission to also solicit applicants for the Maryland Loan Assistance Repayment Program. They're essentially almost the same program, since MLRP provides us our matching money to the federal SLRP award. So there's not much distinction between the 2 programs. As you can see, we have a lot of family medicine practitioners, psychiatry, and pediatricians working that are fulfilling State Loan Repayment Program obligations. We have less on the side of OBGYN. So as you can see here, I've listed out the eligible site types for the state loan repayment program. I'm not going to read out the list, but as you can see, it's a pretty much a broad list. Again, these must be nonprofits. And then the eligible provider types at this time are primary care physicians, including internal medicine, family medicine, general pediatrics, OBGYN, and general psychiatry. Dwayne, you can continue. For an applicant to be eligible for the state loan repayment program, they must be a U.S. citizen or a U.S. national. They must have a medical degree and a valid unrestricted license to practice medicine in the state of Maryland. They must be working 40 hours a week at an eligible practice site, and 32 of those 40 hours must be providing direct patient care to be eligible for state loan repayment program. So if a provider calls and they're, a medical director at an FQHC, but they're only providing 20 hours per week of direct patient care, they would not be eligible for the program. They cannot have any unserved obligation for any other loan repayment program. And I always try to tell my candidates, you can apply for National Service Corps if your site is National Service Corps approved and for the state loan repayment program, but you can only accept one award at a time. You do not want to accept 2 awards. That's pretty bad news. But if you do receive awards from both, you can only choose one. Now, once you're finished your obligation for National Service Corps or for SLRP, you may apply for another program as long as you've completed your obligation. You need to have existing higher education loan debt in good standing, and then there's some other eligibility requirements that are outlined in the criteria on our website. Next slide, please. For a site to be eligible, an eligible practice site is one operated as a public clinic by any federal, state, local government entity or a nonprofit medical care facility. You must treat all persons regardless of the ability to pay, and we do ask to see a sliding fee scale with the application. And as I mentioned before, you must be located in a health professional shortage area. For internal medicine, family medicine, peds, and OBGYN, the provider must be working in a primary care HIPSA. For mental health professions, like for psychiatrists, you must be working in a mental health HIPSA. So if you're a psychiatrist and you only have a designation for primary care, we can't, you wouldn't be allowed, you wouldn't be eligible. You'd have to be working in a mental health professional shortage area, and that's a federal government rule that's given to us based on our grant. Next slide, please. So this year, the application will be open from September 1st, and it closes on October 25th. The Office of Primary Care Access has moved to a twice-a-year application cycle. So previously, we just did an application in the spring for the awardees to start on July 1. So these awardees from the fall cycle will begin on January 1, actually of 2014. I have a typo there. I apologize. And the awardees will be notified in early December if they have received an award or not. Obligations, as I mentioned, are for a 2-year period, and we use a technical scoring sheet to score and rank each applicant, and the scoring criteria is provided on the left. Again, we're prioritizing providers serving in health enterprise zones. We also look at their professional competence, their specialty of practice, their jurisdiction, the rural urban practice setting. We're really trying to expand SLRP into the rural communities because, as you can see from the map, we have a large distribution of SLRP providers practicing in the urban setting. We look at the health professional shortage area score, the number of years the provider plans on working at the site, as well as their loan debt and their salary. So we use a scoring sheet to score and rank the providers based on the information. So there's 8 parts to the SLRP application. This looks daunting, but they're really pretty simple pieces. Parts 1 through 6 need to be completed either by the candidate or by the employer, and then they're submitted to us. Parts 7 and 8 are really just for the candidate and the employer to read. So I'll just run through these very quickly. Part 1 is the SLRP application, and that's completed by the candidate. It just gives us our basic information. You know, we ask a few questions on why they want to work in an underserved area, how long they plan on staying there. We ask for references. So it's just pretty basic information about them. Part 2 and Part 3, which I'm going to get into on the next slide, is actually completed by the employer, and that's the practice site confirmation and the site eligibility application. Part 5, we require a lender verification form for the physicians to send out to each of their lenders, just to ensure that their loans have never been in default and that they're in good standing, and then the lenders will send those back to us. We also ask for official medical school transcript, so that's something that the practitioner will send to us. And then new this year, we've integrated cultural competency requirements into the loan repayment program based on HRSA guidelines. So that is something that the candidate and employer has to sign that they'll agree to. I'll discuss that more on the next slide, but these are the 8 pieces of the application. So for the employer piece, they have to complete a 1-page practice site confirmation and ask basic questions like how many hours a week will the provider be providing direct patient care. I mean, they're pretty basic questions. And then Part 3 is the site eligibility application. So that just verifies that the site is eligible. And then we ask for the following attachments. So any background information about the practice site, the nonprofit certification, any sort of marketing material if available. We do ask for the sliding fee scale and the sliding fee scale policy to verify that you know, the site does have one in effect, and then the public notice to indicate that the sliding fee scale, you know, is posted somewhere saying that, you know, that the site will accept anyone regardless of their ability to pay. And then if they have an employment contract with the site, you know, we like that, but that's not required. And then the cultural competency requirements. So during the loan repayment period, if the applicant is awarded, they're required to do 6 CME credits a year on cultural competency, and they have to, you know, submit their completion to us. You know, they can give us the syllabus or the certificate that they've completed. And that's really just to enhance their cultural competency skills. We ask the sites to do an organizational assessment, and it's really just a survey, monkey survey, that just asks a series of questions, and we're actually working with our Office of Minority Health and Health Disparities. This is our first cycle doing it for the spring applicants, so we're going to see how the organizational assessment works, but we plan on providing any sort of technical assistance that the sites have around cultural competency based on the responses that they provide. So it's kind of a value for the site and for us to see, you know, the level of cultural competency on both ends. And then, as I mentioned, Part 7 and 8 are just to be read and understood by the provider and the site. We have started doing a retention study on J1 and SLRP providers in Maryland, and we plan on publishing a report from the past 10 years over the next few months. So this is something that we want to continue doing, so that we just ask that, you know, after the completion of the program, we ask that we can either contact the provider or the site to see where they're working. And then Part 8 is very important. It's just understanding the breach of contract. Breaching a SLRP obligation is very costly to the provider, so we just like to make them aware of the contract that they're getting into before they make any decisions. Next slide, please. The other workforce programs I wanted to touch on was the National Service Corps, and We will actually be doing an overview of National Service Corps Coffee Talk in October, so please look out for the registration for that. But the site application cycle for National Service Corps is opening September 3rd, and that will end on November 1st. In the past, site applications have been accepted through NHSC on a rolling basis, but this year they're opening it up for a 2-month window. So if you're looking to become National Service Corps approved site, please be sure to, register on the NHSC website and submit your paperwork. And like I mentioned, in collaboration with MAC, we'll be hosting an NHSC overview webinar in October in celebration of National Service Corps Community Day. Also, the J-1 Visa Waiver Program, the 2014 J-1 Visa Waiver Program, will open October 1st for Maryland. From October 1 through December 1, Maryland only accepts applications for primary care in underserved areas. After December 1st, we will be accepting applications on a rolling basis, and that includes specialty types as long as the need can be demonstrated. Next slide, please. And I've provided some resource links here for you. The Office of Workforce Development homepage, which has information about all 3 programs, the SLRP website and the SLRP application website, and then HIP to find to see if your site is located in a health professional shortage area. And then I've also included the link to our Facebook page. So now we can open it up for questions.
So does anybody have any questions of Christina at this point around any of the conversation that she's had and shared with us in terms of information about this new program and new application that's coming up?
Hi. I actually have a question.
Yes.
We had 2 new employees start this week, and they are social workers, and they dropped by an employment verification form to my office from the Maryland Higher Education Commission, and it has Janet L. Hoffman Loan Assistant Repayment Program. Is this part of the Maryland Loan Repayment Program?
So it's not. So the Janet L. Hoffman does provide loan repayment for nurses, social workers, and physician's assistants, and we're actually trying to work with the Higher Education Commission to integrate the 2 programs together. It's kind of been a long road, so that's why I didn't really include it in this webinar today. But that is available for providers, for social workers, nurses, and physician's assistants, and that's over. MHEC administers that program.
I'm sorry, who administers that program?
The Maryland Higher Education Commission.
Okay, so it's separate. Okay.
Yeah, we're trying to see if we can integrate the 2. So we've been sort of working with them, but I didn't really have many updates on that, so I didn't really want to discuss it at this point in time. But
okay.
It is a good, if you have providers that can meet the eligibility requirement, it is a good program for them to consider.
If I have questions in regard to that, who should I contact?
I believe it's Tarika Prater, and I can, if you send me an email after this, I can get you her information.
Sure, that'd be great. Thank you.
You're welcome. Are there any more questions?
Hi, this is Terry in Western Maryland. I submitted a question online, but I can just go ahead and ask. I had a question about the scoring criteria because one of the things that's frustrating for our providers is if they apply and then it turns out that they either get a low score, they're not eligible, and with being in a HEDS being the first criteria, can you give me a sense of what each of those things are worth in the scoring? Because if we're not in a HEDS to start with, does that create a problem?
So I will tell you off the front, this program is not nearly as competitive as NHSC. We have had to turn providers away in the past, but we did receive an increase in funding. So, I mean, I obviously can't guarantee that everyone's going to get awarded that applies this year, but I'm hoping that we will have enough funding to award everyone that's eligible, regardless of them being in a health enterprise zone or not. Now, if I get, 50 to 100 applications, I obviously can't guarantee that, but, we would like to award as many people as possible, but we are prioritizing those applicants that are in an HEZ. So it really just depends on how many HEZ applicants we receive.
Okay.
And to answer your question on the scoring, everything's worth somewhere between 5 and 10 points. The HEZ scoring is worth 10. So they all kind of vary, but they're all generally around 5 points.
And I had an additional question about eligible sites.
Yeah.
One of those listed are federal and state correctional facilities, and we have a number of state correctional facilities in Western Maryland. But to my knowledge, at least the ones in Allegheny County, I thought the medical services were contracted out.
Yeah, they are, and I think a lot of them are contracted out through private staffing companies.
Those companies would be for profit, I assume.
Right.
So those people who are employed there would not be eligible.
Correct. Well, it depends on if they're working for the state or federal facility, or if they're working for a for-profit.
Okay. Thank you.
You're welcome.
Other questions? Okay, hearing none. We want to thank everybody. Thank you so much for Christina for all this great information. We really appreciate it. And we'll let you guys know about the next coffee talk.
And if anyone has any questions after the call, as the information settles, please feel free to email me. I'm here to provide any assistance you may need. So I appreciate you taking the time out of your day and participating.
Thanks again. Thanks, Christina.
Thanks, Dwayne. Have a great day.
Bye. Bye, everybody. Have a great day.